Now, if a parent is starting to suspect that their child could have asthma, what are the signs that they should be on the lookout for?
Yeah, asthma can look like many different things in the pediatric population, mainly because the lungs are different in children. They are smaller in size. The actual anatomy is different. So some kids with asthma will only have small findings, like they'll have chest tightness when they exercise or play PE. Some kids will have a chronic cough. More serious examples on that same spectrum are patients who present with multiple infections in the lung, like saying they've had pneumonia 2 or 3 times in a year. Those types of findings are also red flags for the potential underlying diagnosis of asthma.
So, if a parent has noticed that their child is wheezing on the playground, if they have perhaps had pneumonia a few times in the last year, and they're planning to go to their pediatrician with these concerns, what can they do to get the most out of their visit?
That's a great question. I know that many times general practitioners would like to believe that asthma is not as prevalent as it appears. In fact, many times there's an alternative diagnosis that's often stated, which is reactive airway disease. And the difference between reactive airway disease and asthma is only the persistence of symptoms, where asthmatics or asthma will have continuous persistent symptoms and requires long-term treatment. So when a general pediatrician hears a child wheeze once or twice, they are relatively reluctant to label them as an asthmatic. But the fact is, given the incidence and how frequent, or the incidence of the actual condition and how frequent patients are going into doctors' offices for asthmatic symptoms, we have to kind of lower that threshold and convince these physicians that it's worthwhile to actually pursue a better diagnosis. The best way to do that is to ask a general pediatrician for simple things like a lung function test or a breathing test. Breathing tests are the best diagnosis for asthma in addition to some other tests. And if there's ever a concern of repeated episodes of wheezing or repeated episodes of asthma-like symptoms, a simple breathing test called a spirometry is sort of the best initial test to ask for.